right, choose your best answer. I need to put more challenging questions. You guys are super fast. Look at that. Wow, 50 answers in less than 30 seconds. Wow. The instruction yesterday must have been helpful.
It's your technique.
Thank you, my dear. Oh, okay, we got 20 seconds. So we got 6 answers.
I did everything I can answer.
I don't know how to help you on that one. All right, so almost everyone got it right. So remember in the lecture yesterday, I said Erikson, it's very important. You are likely to have maybe 3 questions on Erikson. There are total 17 questions on therapies and related theories. We cannot afford to miss 3 questions on Erikson. So Erikson alone might take 1 hour of your time. Over time, might take 1 hour, but that is 3 questions. It is high yield that we do not miss any Erikson question. However, the only way we are not going to miss is if we take our time early. Okay, so here you go. Our 5th candidates that are leading right now. So identity versus role confusion. What is the right age? 12 to 20. The question gives you 16. Right there, you're going to continue to read the question, but you should know this is identity versus role confusion. Trust versus mistrust. What do we learn? The PEG system. Trust versus mistrust, right? Then we learn autonomy versus shame. The PEG system said someone named Shane. And we have initiative versus guilt, which is the 3rd stage. So this one was fairly easy because it went from baby to toddler to the 3rd stage. So kind of all lower numbers, right? So if you got it wrong, you have to go back.
Get the full 30-day walk to success PMHNP review course https://npexamcoach.com/live-pmhnp-review-course/ref/NYMER/ use code MD150 for $150 off. Limited time offer.
To Erikson, take your time. Okay? Now, let's go to the next question. Harder, huh? Kindly keep your mics muted, please. We're recording for the others. All right, we got 5 seconds. You better pick your answer. Come on, 1, 2, and that's it. All right, this is going to force you to pick an answer. So the more you study the material, the faster you will be. So we had last, I think 3 weeks ago, someone from Europe, and she was saying, well, you know, I don't have enough time because I can't read that fast. The moment that she started getting the material, her score improved and she became faster. So this is one of those techniques, right? So getting to know the material will help you on your time. So what we know about this one, right? It said something about school, doing activities. Remember about the PEG system, industry versus inferiority? Do you remember the dinosaur feeling inferior? If you're just hearing this today, you might be totally confused, but that's okay. This is something that we went over the class, okay? Industry versus inferiority. So this stage is middle school year. So what is important for middle school? So let me tell you what is important, because something really cool just happened today. At least I think was cool. I'm driving through my neighborhood, and my girl, she is 12, and she stopped me and said, "Daddy, Daddy." And I was like, why is she so excited? She's never excited like this to see me. And she's like, "You're not going to ask me what happened in school today?" And I'm like, oh God, what happened? Well, when I got there, the principal called me and said that I needed to come to his office. So when I went over there, he said, I want a speech. Now I have to do a speech for the entire school. I mean, this is a perfect example of industry versus inferiority, right? Able to do things middle school age. They focus on the important academic, social, and practical skills. And friends. Friends is also super, super important. Autonomy versus shame and doubt. That's the second stage. Really, 1, 2, 3, right? Is associated with developing a sense of independence, right? The kid can be able to walk around, crawl, little steps, going around the house, exploring. Generativity versus stagnation is almost the last one, right? That's the one that are adults doing things for the community, doing things for the family, getting ready for work, taking care of business, feeling accomplished. And then we have initiative versus guilt. This stage is placed during preschool. Again, if you know the age, if you take your time to memorize the age, you will get these 3 to 4 points on Erikson. It's going to take a little bit of time, but we'll get all the points on Erikson. This is all about memorization. It's not very tricky. It's about time with the material. The more you spend with the material, the more questions you will get. Not very tricky. Six-year-old boy. All right, we got almost 60 answers in 40 seconds. Okay, 60 in 40 seconds. That's pretty good, guys. We got 18 seconds left. All right, 5 seconds now. All right, everyone is in? Okay. All right, 1 second, guys. Wait. Was it 6 years old, 12, 6 to 12? So it's right in a corner, right? Industry versus inferiority, a sense of competence and industry. The child who struggles with this stage may feel inferior and incompetent, max difficulty in interacting with peers and seeking adult reassurance before decision aligns with the challenge in this stage. Again, this one was a little bit more complicated, right? But they give you the age.
Does anybody have the questions? I thought I saw 3.
What do you mean? What do you mean by anyone has the questions?
I'm sorry. I thought maybe I read something different. I thought I saw 3 to 6. It was 6. I don't know.
Yeah, it was 6 years old. I don't have my phone. Oh, I'll take a picture next time.
C, it says 3 to 6, and then on the right answer it says 6 to 12. So
yes, so
there's always on both sides.
Right. So sometimes it can happen like that, but on the test it will be very accurate and it will not be in the fence. Okay, so this one was a difficult one for sure. All right, next question. All right, we got 20 seconds. Awesome. Absolutely awesome. So as I was driving home today, I don't know why I was thinking this. If you look, trust versus mistrust, integrity versus despair. So it's 8 stage. We can now need to memorize 6 of them. And then we have the other ones that are kind of easy. So the first and the last, we can already take it out. So now your job is really to memorize the 6 after that, right? So it kind of makes it a little bit easier. So these are the extreme, right? So yeah, Martha, she can sit down on her porch and reflect on her life and feel that she has accomplished things, right? And she feels integrity, not despair. Her neighbor that did several things that was not congruent with, with society, thought about himself all the time, and he sat down in the porch and thinking about his life. Now he is into despair. Okay, 65 and older. She's 80. All right, we got 6 seconds. Okay. So the question said something about her feeling guilt. Okay. And the age 3 to 6 involves develop a sense of a purpose and the ability to initiate activity. Guys, this is a warning, and I do understand that maybe you're just starting on module 1 or you're on module 2, but we need to get Erikson tight and loaded, ready to go. We cannot afford to miss those questions on Erikson, right? So don't try to memorize Erikson a week before the test. That's going to be too late. So if you didn't get those questions right, reflect on what you may need to improve on. Okay. We got 20 seconds left. Well done, guys. Well done, right? Again, Piaget, only 4 stage. So, Peter can fly. So, the S, sensorimotor. Peter, preoperational. Can, concrete, fly, formal. F for formal, right? And we know the sensorimotor. There is object constancy and object permanency, right? If you think about this is object constancy, right? If you think, so what is object permanency? Think of a permanent love, meaning that if the borderline patient has not mastered the sensorimotor, again, it's Piaget. Piaget, age does not matter. It can be a 35 years old borderline patient that goes into distress when the therapist goes away on leave. So we're talking about sensorimotor, object permanency. What is that? The baby knows that the mom goes to work, but she'll come back. Temporary absence does not mean abandonment. However, if they have not mastered that, then they will have a problem on sensorimotor, even though they might be 30 years old. For the test, do not fall for age. Okay, for Piaget, age is very important for Erikson stage of development. Now, again, let me see if, now another, I want to point out because I don't know what the next question. A lot of people get confused. Concrete. 1 second, guys. Please mute your mics kindly. Thank you. We're recording for those that might be watching later. Thank you. So, concrete versus formal. A lot of people get this confused. Which one is which? Think of the C for concrete before the formal. When you hear science project, abstract thinking, hypothesis, think formal. F for formal. Okay? So, sensorimotor, Peter can, concrete, fly, the F. So these are the 4 stages we kind of need to know, because again, these are easy points. They will not be tricky. So we just need to buckle down, memorize it, and move on. Age does not matter. Right, 3, 2, and 1. Okay, so we cover preoperational, and we said egocentric. They only see the world from their own point of view, right? And we said magic thinking, and we also said imaginary friends. The 3 things that we talked about preoperational, right? So imaginary friends, I'm pretending I'm a cook, I'm pretending I'm a doctor, I'm pretending I'm a nurse. Magic thinking, is the ability or what they think. Their thoughts will dictate the outcome. Everyone, kindly please leave your mics muted unless if you have a question then you're muted because we are recording, please. So think about those things, okay? So if you can pick up 3 things for each one of these, it will be super high yield. All right, so preoperational, 2 to 7, but again, we are not looking for age for the test. Okay. So thinking, symbolic thinking, language, and egocentric, pretend play, and magic thinking. Magic thinking. So the magic thinking is the ability the thoughts can dictate the outcome. Okay, so I think we beat this Piaget to death. Now everyone should get the next question right if it's Piaget. We talked about preoperational, we talked about sensorimotor, we talked about concrete, and we talked about formal. So let's see if we got one more question. I really don't know if we would do. All right. So everyone's going super fast now. Love it. Very proud of you guys. Look at that. 60 answers in less than 20 seconds. Good. Very good, guys. So now you know what a confidence feels like. Wow, everyone is done answering the questions and we got time left. So that's great. Three, 2, and 1. Let's go. All right. So again, I made sure to highlight this and say at least 3 times. And if you got it incorrect, it's a good opportunity to identify it. If it's a science project, hypothesis, abstract thinking, F, formal, is the latest stage. If it's a simple math and other small things in science, concrete. You got to know those 3 things for the F, for formal. Again, this is not a very hard question. It's a memorization. So time spent on the material will lead to success. Repetition will lead to success. Right? And don't forget that F for formal is the later stage because a lot of people will confuse this. The C, concrete, is before the F. The F is for abstract thinking, hypothesis, science project. Is anyone confused? If you picked concrete, if you want to speak to it so I can better understand where you're coming from, we can talk about it. But I do not want you to miss this question or test.
I just pressed the wrong one by accident.
Yes, it
I
will
looked
happen.
at it, I said, oh my goodness.
Yes, I've done that many times. So thank you. That really helps me. Okay, great job. I mean, it will happen, accidents, right? But I want to make sure that you guys know the material. And guys, I sound like a broken record, but this is the most important test of your life, of your career. We cannot afford to play around. We have to go all in, all hearts and minds for your success, okay? All in. Okay, we have 5 seconds left. Pick your answer. Okay. Please, and I mean this in a good way, please help me understand the concrete versus formal. Why someone thought it was concrete.
That
Because,
was the same question.
I'm sorry?
That was the same questions.
If it was not the same, was very
I mean,
similar.
similar. Yes, very
Very,
similar.
very similar.
And the word
So,
hypothesis is there too. So that's
exactly.
yeah.
So, and that's why I repeat, and repeat. And sometimes I find myself being annoying, but it is for your benefit. So if someone kindly help me how to help you, like, so I can say something different. And I get it. If you press it wrong, I totally get it. I've done that thousands of times, especially on Kahoot, right? Hopefully not on a test. But if is there a better way to explain, I want to know, because we just covered the subject. The identical question, was he on purpose? It's fine if you don't want to speak to it. And I'm not criticizing. I really want to help you understand. Unless if you speak to it, then I don't know how to. Okay? And you can send me an email, PMHNP@mpexamcoach.com. You don't have to speak in public, but if you can help me better understand how I can say it in different ways that can be helpful to you, I actually appreciate that.
Hi, Dr. Lopez. Please,
Hi.
can you please explain more on the concrete?
Yes. Okay. So when we have, okay, instead of me explaining, what do you know about concrete? 2 things. Do you remember the concept of a reversibility? Okay, Mary?
The way I got it was, I remembered that, it's like they're at school, but they're not that advanced in school, that where the hypotheses and the equations and all that stuff is a higher level of thinking, where concrete is, they can, do their numbers, they can do their, and then I remember your cup, they can have some idea of what problems, but not that higher level.
Good, good. And remember, the C is before the F. The question says something about physics. They are not, this is a higher level of thinking, right? Higher level of thinking. So who can speak to concrete? And one of the things that we talked about was reversibility. What is that?
That specifically was like, say, with ice that can turn and melt into water. For that concept, there's other ones that I think that one was talking about the glass and size-wise with short and tall glass that you can put the same amount of water in. So it's like those basic, I'd say basic concepts, because then anytime I'm thinking analyzing something, projects, stuff like that, that's the formal part. But the basic knowledge that you start having in grade school is where I think concrete. So
okay, so if you think reversibility is reverse. Water can turn into ice. Ice can turn into water. 4 plus 3 equals to 7. So is 7 minus 3 equals to 4. Is also a reverse, right? So numbers can reverse and be the same answers. Ice can turn into water. Water can turn into ice, depending on the temperature. So when we think of concrete, we think reversibility, and we think about conservation, right? Who can tell me something about conservation? So understanding that something quantity does not change, even if the appearance does change, right? So think of a example. If you take a ball of dough and flatten into a pancake, a child at this stage knows it's still the same amount of dough, just a different shape. That is conservability, right? And reversibility is understand that the action can be reversed. The concept of fundamentals to mathematics and so forth. So thank you for asking that question, because you are very likely to get few questions on Piaget. And these are not hard questions, but it's questions that you need to spend the time to take it to understand, so that we can get those easy points. It's not like motivational therapy that can be tricky. It's not Seabird that can be tricky. It's not like a trans-theoretical model of change, preoperational, preparation, and so forth, that can be tricky, right? These are easy points, so we gotta have the easy points. Okay? So hopefully now we understand So Peter Can Fly, the stage, and what falls under each one of those stages. Please take a second to read. Concrete logic, 2 plus 2 is 4, and concrete thinking, right? All right, so now we definitely got it right? There's only 4 options, and we went over those options in details. Let's see if we have another question. Oh, no, we don't. Okay. So who helps to uncover the unconscious conflict? Who is the father of this therapy, and who is Freud, right? Which is psychoanalytic. All right. We got to know that too. All right. So who helps with identify the root cause of anxiety by exploring past trauma? It could be CBT, but not really. In this, it could be CBT for trauma. I got it. But what are the few of the therapies that are high used for the test?
I think it's psychoanalysis, but
No.
EMDR, psychodynamic.
Okay,
I say
EMDR, exposure therapy, right? All right. So now, CBT primarily relies on medication?
No.
No. Today I had the patient that had been on Adderall and fluoxamine. Very seldom, right? But he said he wasn't happy. He wanted to be out of all his medication. This is my first time I got this patient. And I said, okay, let's do this. Let's do 60 days of therapy. And then you can decide after that if you want to do medication. So what therapy I chose? CBT. Very structured. I do it very structurally. Problem And then we kind of have some writing. When you hear CBT, you think of journaling. You have to write your thoughts. And cognitive restructuring. These are two words that you need to remember, right? So we can say, well, let me answer here the question. Good job here, everyone. That's scoring super high. So we can say CBT corrects the maladaptive patterns of thoughts and behavior, right? To reduce the anxiety. When you think about CBT, think about your thoughts influence how you feel, that influence how you act. If we can change the thought process, we'll change how you feel, therefore you will act differently. But everything starts with the mind. Okay? And it's not like a pill that you take and then like, oh, I feel relaxed, I feel calm. It will take exercise and getting better over time. Okay? All right, let's go to the next question. These are good questions, so we can apply what we learned.
Some question?
Maybe, maybe not. Interesting. Okay, so I do apologize. My apologies. The answers does not match the question, and obviously this is not exposure therapy, right? So two things that we need to be aware when we say CBT, journaling, and cognitive restructuring. So my sincere apologies here for this mistake here. So
Only two people got the answer. I guess.
Yes, but it is wrong, okay?
Oh, shoot.
Please mute your mic, everyone. Okay, this one's hard, right? So let's take a look at the rationale. First, when you hear OCD, think about CBT, okay? But the second one that's super high yield is also exposure, response, and prevention, ERP, right? So we can use that as an effective behavior therapy technique for OCD. Right, it involves the patients that has anxiety-provoking situations, and we turn the situation to prevent them from engaging in the compulsive behavior. In this sense, is the response, right? So it is. Some would say this is the gold standard, but some would also say that CBT is the gold standard for OCD. So and when you hear OCD, think of a CBT and ERP, or exposure response prevention.
Dr.
Okay.
Lopez,
Yes.
in CBT, there is a part of exposure therapy as a part of CBT.
No.
Well, it could.
Yeah,
It could, because it's part of the
CBT.
behavior, right? It's
Right.
part of the behavior. So yes. So think of the cognitive. CBT is two therapies in one. One is the cognitive. So what we're trying to do, reverse the maladaptive thoughts process with a positive one. The behavior is the second part. What are we trying to do? Reverse the maladaptive behavior, the doing it, something wrong or incorrectly, to a positive one, like modeling, like meditation, like role playing, or exposure to a behavior that will decrease over time.
So
Okay.
are you saying exposure and response therapy is a separate therapy beyond CBT?
Yes.
Okay,
Yes.
because I know during CBT, you can do exposure therapy, like for
Right.
example, if a person was in a car accident, they don't go down that street anymore. What you do is you first drive by it, and then you have them sit in the area until they get used to it, get desensitized. So I got a little confused. I was thinking of exposure therapy, but I was also thinking of CBT as an exposure therapy. I don't remember this one. I don't know why. I don't remember seeing exposure response prevention.
So think of this one much like EMDR, but of course it's not. EMDR is with your eyes, but the principle is the trauma, right? So I think you are confusing both. So while CBT can be transformed for trauma in itself, but exposure response therapy is the high yield for trauma, and EMDR is the high yield for the trauma for the course, for the test. Okay.
Okay.
Right.
I'll get it now. All
Okay.
right.
Okay. And I think this is a mistake, right? Someone had the fast finger and picked cognitive behavior therapy. Otherwise, you can tell me what was your rationale if you want to. Again, it doesn't matter where you are today. It doesn't matter if you're on the top or on the bottom. No one is smarter than no one, right? So it's just that we have different experiences. That's all. Everyone is equally smart, and all of you guys are equally smart. But maybe you're starting the course now, or you just graduated, or maybe you forgot about this. We need to go back to the basics and learn this, okay? None of us can afford to easy questions to miss. This is an easy question. What do we know about borderline personality? We gotta know dialectical behavior therapy. We gotta know what is the goal for dialectical behavior therapy. Decrease suicidality, decrease crisis. There is more things, but I'm simplifying. And we gotta know who created DBT, Marshall Lineham. 3 things that we have to know. Okay. All right, so let's keep on going. Take a minute to read, please. You hear cognitive behavior therapy, immediately you got to think iron back, journaling, and cognitive restructuring. If you hear psychodynamic, you got to think about Fyodor. Okay, explore the unconscious minds. If it's unconscious, we don't know it is influencing us in the present. So things that happened in the past can influence how we act today, and we are not even thinking about it. Doesn't even cross our mind because it's unconscious. Oh my. Okay, so this one, it was hard in disguise, right? So one person, just lift your hand and tell me which therapy was it looking for? What's the name of the therapy?
Existential.
Yes, thank you.
Yeah.
So let's go ahead and cover existential for a minute. Mute your mics, everyone, kindly, please. So when we think about existence, think of this way. What is the reason for my life, right? If we think about existential therapy, we are going to look at accepting freedom and making responsible choices. So doing existential therapy is suited for those facing existence problem. For example, those with a terminal illness condition, or those contemplating about suicide, or even those that are going through a transition in life. I don't know what it was this week. I had so many people coming in where their partner said, goodbye, I don't want to be with you. I had 3, and they came in extreme distress. It was just the flavor of the week. Okay, so we want to encourage self-confrontation slightly, right? So focus on the present and being responsible for the choice. If you think of existential, think of what is the reason do you want to be alive? Why are you here on this earth? Now, before someone asks, it falls under the humanistic umbrella. So the answer was in disguise here because it was under humanistic. What else fall under humanistic? Logotherapy.
Logotherapy.
Right? And if you say logotherapy, we have to think of Viktor, Viktor, Viktor Frankl, right? So he said, well, logotherapy is a little bit different. It's kind of complicated because it seems like existential. But how is it different? It focuses on helping individuals find meaning in life. If you hear meaning in life, particularly during suffering or existential challenge. Okay, so these are important concepts. They emphasize the search for purpose, freedom of will. What else? Abilities of one's choice, response to life's circumstance. Okay? So now I want to go back to the previous question, which was ERP. And someone was saying, hey, CBT also can be used for that. So let's cover some of that, and I'll give you a little bit more of an explanation. So CBT can be used for that in this way. So trauma focus, cognitive behavior therapy, right? So if we do trauma focus, cognitive behavior therapy, we'll address the mental health needs of children, adolescents, families suffering from destructive events in their earlier trauma. Treatment is particularly sensitive to unique problems of youth and traumatic events. So it can be used as well, right? But it's a modality, or like the little child of CBT. Okay. All right. So, Evelyn, do you have a question?
Yes. Can you talk a little bit about Gestalt therapy too, please?
Gestalt?
Yes.
Okay. So who wants to give me a little bit of Gestalt? It also falls under
Humanistic. Yes.
Humanistic. Okay, so that's good. What else about Gestalt?
The here and now.
Here now. Great. And also, what else?
The empty chair.
Empty chair, dialogues, not super high yield Gestalt, but what you need to remember is the humanistic is the bigger umbrella. Let me mute everyone's mic because it's echoing. What you need to remember is humanistic is the bigger umbrella. Under that, we have the father or the big dog, which is person-centered therapy. And that is Carl Rogers. And Carl Rogers said only humans can self-actualize, right? Or being the top of the Muslim pyramid. If you don't understand, if this is the first time here with me, is because we talked about this in the class. Okay, so for those that are here, it kind of makes sense. If you're new, it may or may not. What else? We got existential therapy, Gestalt, logotherapy, and other variations. Okay, but you got to know person-centered therapy that sometimes is also interchangeably used as humanistic, how close they are. And you got to know who is the founder of person-centered therapy, which is Carl Rogers. Okay, so keep on moving so that way we can play a little bit more. But these discussions are good, okay, because it helps us. So today at the end, I'm going to do a crash course on Module 4 in under 10 minutes again, okay? So we're not going to learn because we learned this in class, but we're going to revise all 27 topics in less than 10 minutes, okay? Give me a second, and once this question is over, we'll unmute your mic there. Okay. Out of the whole question, it says personal growth and self-actualization. Who's that? Carl Rogers. And Carl Rogers is person-centered therapy. I get it that someone might want to Gestalt because it falls under the bigger umbrella, but you got to look for the key words. In the beginning of the question was kind of iffy, but then it had personal growth and self-actualization. Bingo, easy points. Another one towards the board, okay? We got to catch up on those easy points, guys, okay? Because some questions, it will be confusing and it will be hard. But questions that are easy or questions that we can memorize and understand the main principles, and then we can apply that to any question. All right. Someone has a question. If you do, please unmute yourself and ask. Paul X, I4X, not sure. You have to unmute yourself. Okay, so here we also have Gestalt. Take a look on that. Help individuals become aware of their thoughts, feelings, and behaviors in the present moment. So that answers the question. In the present. Okay. All right. So we'll keep on going since the person has not unmuted themselves. So maybe it's a mistake. Next question. Your mics are on. Okay, so I want to read the question, otherwise I would forget. We got a 50 years old female who is experiencing existential concerns. So we know this is existential therapy. Then we got to peel back the onion and ask, what is part of existential therapy? Right? So she frequently reflects on her mortality and has feelings of anxiety and despair. The issue, the patient expressed a desire to explore those existential issues in therapy. So pretty much said this is existential therapy. Which aspect of existential therapy is the most aligned with addressing the patient's essential concern? So it told you this therapy, which of those aligns with existential therapy, right? So the first thing that I talked about existential therapy is emphasis on freedom and making responsible choice, suited to those with existence crisis, facing why do I exist, those with terminal ills, those with contemplating suicidality, even those going through life transition. We said it's all about self-confrontation and focus on the present and personal responsibility. Okay? So, and then examines the patient's freedom and responsibilities. Right here. Okay? Not as easy as the previous question, but if you understand and you read through the PDF, it becomes sort of easier. Okay? But I can see why someone might pick unconscious conflict, but that's Fyodor. Okay? Fyodor. So here we have it. Freedom and responsibility. Responsibility. If you pick unconscious conflict, kindly take a look how they are very different, right? because I want you to pass the board. I really, really do. I really do. So we gotta correct those mistakes. And please never think that I'm being harsh or pushing you to do something that you may or may not want to do, but I really want you to see you pass. Okay? So we gotta work through those issues and better understand and find a solution to whatever is not working out. Sorry about the misspelling there. So this is going to be 100% right. All right, close to 100%, right? We gotta know I, movement, desensitization, and reprocessing, right? So sorry about the mistake there in spelling, but the main phrase is correct. So when we think for the board specifically, and really in real life, it is the therapy of choice. It's eye movement desensitization. You need to know the phases, and you need to know what to do on the phases if the patient decompensate. Okay, we talked about that in class. So it's very important that you guys key in. And I know not everyone is in our class, but if you are, you need to send me an email, and we need to kind of find a way if it's not well understood, so that we can get those points. Okay. Okay. We're getting closer. So I took a picture on purpose so we can read. I can read to you, and then we can look at the answer. So PMHNP is working with a 28 years old male patient who presents with symptom of anxiety, low self-esteem, difficulty in forming and maintaining relationship, blah, blah, blah. Nothing said, right? So now that's important. The patient report experience constant worries and feelings of overwhelmed by life demands, yet nothing important for the question. So then it says, he describes a persistent fear of rejection, criticism from others. The PMHNP believes the psychoanalytic therapy may be beneficial for the patient. So out of all this fluff, all what I care is we're talking about psychoanalytic. Which aspect of a psychoanalytic therapy is most aligned with addressing the patient's need? All the fluff, I can throw that out. I can just look at the end of the question to answer this question. So the core of the question is, which aspect of psychoanalytics matches my answer. And if we talked about psychoanalytics, we're talking about the unconscious mind influencing our behavior, our present, something that has happened in the past that we're not consciously aware affecting us today. And unless we bring that to life and become aware of it, the problem will persist. Okay? So we got to know those details, okay? But I can see this is maybe a little bit harder than the previous questions. But we'll get you there. We'll definitely get you there, okay? So this option aligns with psychodynamic or psychoanalytic. Some may say they are different, but almost the same, right? They emphasize the exploration of unconscious conflicts, emotion, and early life experience to gain insight into the current psychological struggles, okay? All right, we can always use process of elimination, right? But yeah, this is assessing the family patterns of communication, roles, and interaction. So yesterday we talked about family system therapies and all the other therapy, solution, strategic, structural. And we said we need to put that in a different piece of paper. One that we can wake up in the morning after we set our prayers, we can look at it and be like, okay, I remember 3 things of each one of them. This is going to help you a whole lot because it will be questions on family system therapies or family therapies. And we need to get those answers, okay? Each answer counts. We have had people not pass because of one answer or one question. Let that not be you. Okay? So if we talked about family system therapy, we have to remember who is the creator or the founder of that. We have to remember triangles and triangulations. And most important, what is the goal of family system therapy? Self-differentiation, okay? We gotta know that, guys, okay? And we're gonna go over others. I believe we have fewer questions on family system therapy. Okay. The key here, it was this autonomy, right? So emotional balance and autonomy, that is the key for self-differentiation. So what is self-differentiation? In my family, I'm the father, I am the husband, but I am also Dr. Lopez. I have those roles in a family as a father and as a husband, but I still know who I am and what I do as me, right? So I still have my autonomy. That is the goal of family system therapy. And you need to know Bowen is the founder of family system therapy. Okay, so now let's see what the answer says here for you. Formal answer. Okay. Mavis, go ahead.
Dr. Lopez, so I'm just now realizing that when they speak of self-differentiation, it says requires each parent, but not necessarily the child doesn't have to self-differentiate, because that's what threw me off when it said autonomy on there, because I was thinking if it's
everyone. Is everyone, right? The child is still the child of the family, but the child is also the child that wants to play and do what childrens do, right?
Yeah,
So
yeah, I get all of that, but the part that threw me off is when the answer said, the first part, I forgot what it said. I understood the self-differentiation part, but then it mentioned autonomy. And when it mentioned autonomy, I started thinking about if it's the child, then they wouldn't have much autonomy. And it seemed like the answer is basically only talking about the parents with the autonomy.
No, I mean, is each member of the family, they are part of the family and they have a role in the family, yet they're part of their own autonomy. Everyone is different and we still can come together.
They make their own choices.
Yes.
Everybody make their own choices.
Absolutely. And together we make a family, right?
It just takes me longer to read these questions.
Yeah, no worries. All right. Thank you. So we'll keep on moving. But these are important concepts. Okay?
Dr. Lopez, I
can't stop now. Hold on, my dear. I cannot stop because the question is going.
I lost my pen.
Okay, so this is a hard question, but most of you guys really got it right. Restructuring the family roles and boundaries, right? All right, so we got that right. And that is poor as high yield. When we think of structure, we think like the military with boundaries and hierarchies and genogram maps, right? The ranks, very structured, not crossing the boundaries. So it helps you remember of the three components that we need to remember, right? Reframing as well. Okay. We're almost done. We got a few more questions. So when we hear MST, immediately you gotta think 12 to 17, youth, target the youth. Those with serious, I would say, antisocial traits. They do not have antisocial disorder because they're not over 18. They have problematic behaviors with serious criminal offense. And the goal is to empower parents with resources and skills to reduce barriers, right? So that they can effectively manage their youth. MST is typically uses a home-based model plus a community to reduce barriers and keep family from, not keep, help families access the resources, right? So the goal is really to empower the parents and improve their effectiveness by identifying strengths and developing resource and support system, right? So ideally, when you think MST, immediately you think youth with problems, and we have to help the family address those problems. Now we MST, right? Next question. Solution focus. Okay, I just want to, I saw something on my email, kind of like, I think it was the question that we put in our group forum. Mr. Bonner, he said this came to my inbox. It says B, solution focused therapy, hint, we are looking for a miracle solution or exceptional solution or a scaling solution. So when we talked about solution, family solution therapy, we're looking for something that worked in the past and we can reuse it, right? To find the golden nugget. So think of a miracle solution or exceptional questions that we covered yesterday, the concept. Okay, so I thought it would be helpful. Helps the family envision a future where the problem have improved or resolved. That's a miracle question. What if you did not have to take the test and you could practice tomorrow? How would you feel? Right? It's encouraging the patient to really imagine what my future would be like if I didn't have this problem. Would I feel proud of myself? Would I feel that I finally crossed the finish line? Right? Okay, guys, I'm really proud of you all. All of you guys got it this one. Almost everyone got it correct. So if you didn't, it's okay. We can get you there. But just to really go over this one more time, if we think about solution, we think of solution that worked in the past and we are going to reuse it today. And what are the three things we need to remember? Miracle question, exception finding question, and the scaling question. So we worked the system yesterday that we are going to put three things for each one of the family therapies, and we are going to look at it every single day. Because when we say solution, we got to remember, we're going to use something that we used in the past and we know it worked. And three things we need to remember is miracle question, exception finding question, and scaling question. So we need to know the definition. Now is not the time for this, but these are the scaled in which we'll broaden our knowledge so we can pass this test. Okay. Sandy, do you have a question?
When I think about solution question, I think about future. It takes me straight to the future. So I black everything out and just think about the future. That's how it works for me.
Yes, but then you're looking more of a miracle question, right? Like that is one component. Yeah, that works if it's for miracle, but if it's an exception finding question, may not work as well.
Thank you.
Okay.
Thank you.
Mm-hmm. Strategic. What we say we do. All right. When we get strategic, we use the hand. We're going to give a straightforward directives. The other point that we need to know is paradoxical directives, right? Or straightforward directives. So when we think of strategic family therapy, we think of a problem focus, symptoms focused, and we're going to give them directions or directives, the hand. Now we can use that against someone that is restrictive to change. And if that is the case, we're going to give them a tricky one, which is a paradoxical directives intervention, right? And we only going to use this with caution, right? Only for those that are resistive to directives. All right, Evelyn, do you have a question there?
Yeah, my question is like, the paradoxical therapy, you have to be very careful. So when it concerns the baby or the children, that's where I got thrown away. So I don't know how we use it with the children. They are not that reasonable. I don't know. Can you explain a little more?
Yes. I think you're thinking too in depth in the question. Ideally, in real life, we wouldn't use in a child, right? We should be able to, mothers and fathers and parents, they should be able to have more of a control. That is more towards an adult that is resistive to directions or following through with their commitments. I think you are thinking too in depth here, too deep.
Okay, thank you.
Mm-hmm. All right. Not sure if the question had age. You also said the baby. So strategic. Again, the hand. Oh, this is a hard question, guys. All right, so this was a very confusing answer. So let's take a look here. Okay, so here it was confusing because actually I confused you. I said strategic and had straightforward directives there, right? But remember what else it is part of strategic? Reframing. Right? So when do we use reframing and when do we use a straightforward directives? Right? We use a straightforward directives to someone that will follow through, right? Go home and buy a bouquet of flowers to your wife. Now, when we use reframing, we want to challenge and change the client's negative beliefs and self-perception. Okay? So if I misled you here by saying straightforward directives or paradoxal, that was not my intention, but it is fall under strategic there. Okay. Do you have a question there, Cecilia?
Yes, Dr. Lopez. Is there a challenge? I saw challenge the client. I know we never challenge client. That's what I didn't like that answer.
Okay. Yeah,
I see the reframing. I was thinking about the reframing, but I see challenge the client, and I'm like,
but you're not challenging the client. You're challenging the negative thoughts and behaviors.
Okay.
You're not challenging the person. It's like you are thinking, if I walk by you and I don't say good morning, the negative thought is he doesn't like me. He's stuck up. He doesn't talk to people. He's on his own thing. When in reality, it could be that my wife is leaving me, or I'm going bankrupt, or someone is taking over my car because I can't make a payment. Could be so many other things. So we're challenging what is the rationale and what evidence do you have? That's what we're challenging, not necessarily challenging the person. We're challenging the thoughts. Why is that you believe immediately that he doesn't like you, for example? Okay.
Thank you.
Yeah, so the good distinction.
For example.
Sorry. All right, Mary, you have a question?
One more statement. I'm getting confused. I'm gonna have to go back and make a card on this, because I'm getting confused because I'm thinking of the hand, and
Yes,
it's more so with the first one is we're going to give you times to be home and you better, and here's the consequences if you're not.
Right. So the three things that we said for strategic: reframing, straightforward directives, and paradoxical directives. So this one was towards reframing, right? But you still had straightforward. That was something to catch those that are just looking for a straightforward and made the connection with strategic, right? So it's more of a elusive answers, and you will find those on the test, lots of them. So this is why it's important to kind of know what is under, but also understand what does it mean. Okay, so we'll keep on going here, guys. Otherwise, this will take longer, but we're almost done, actually. So sorry about the misspell that. That's supposed to be denial. My folks are failing me here today. All right, so my apologies here. So denial, right? So it's a common defense mechanism to avoid facing distress and painful experience. But take a look on reaction formation. It involves expressing the opposite of one's true feeling as a defense mechanism. This mechanism is not the most likely explanation for the patient's behaviors, as they are not expressing the opposite of the true feelings, right? And we talked about rationalization and displacement yesterday. Okay, so we could do this in several ways. We could look at elimination choice and arrive to reaction formation. We just said that the reaction formation is one that's not being true to their feelings. So someone with major depressive disorder, they are not boisterous and super happy. Exaggerated feelings of happiness, contentment, and enthusiasm, often laughing loudly and engaging in boisterous activity. The patient's behavior seems excessively cheerful and appears inconsistent with the underlying depressive symptoms. So if you didn't know reaction formation, you could say, I know displacement. I'm displacing my feelings into something weaker, the dog. I know sublimation. Instead of hating, instead of being super angry at the gang, I'm going to teach nonviolence. And this is not a regression. I'm not returning to an earlier stage, right? Or in that sense, right? So we could arrive to the answer in several ways. Or either by knowing exactly what the question said, which is always easier if we spend the time on the knowing. But we can also do the backward ways, which is process of elimination. But don't be afraid to use process of elimination when the time comes. Okay, ideally you want to look at the question, do not look at the answer, and immediately you got to think, I know the answer, and then you match. Otherwise you might lose a few points because the questions can be tricky, right? And can make you change from A to D when you knew the answer was A, right? Great question there. All right. Great answers there. Okay. So we almost got 100%. We're getting close to 100%, and that makes me super happy. Repression in this scenario, the patient's difficulties in consciously recalling specific details of the traumatic event is indicative of defense mechanism of repression, right? Like PTSD. In a sense that they only see fragments of what happened and not entirely the whole thing. All right. Let's say I had no idea who Yalom is and why group therapy is so important. I have no idea. Let's call it this way. But I want to read the question then. If I have no idea and I'm a high schooler and I read this question, it says members are encouraged to explore interpersonal relationship. And I'm like, okay, I have no idea. But the only option that matches the question is the interpersonal learning. That is not cateras, that is not universality, that is not experiential factors. So what I'm trying to say is, even though you may not know the question, the answer, look at the stem of the question. It may say something similar in the question. In this case, it was straightforward, almost word by word. It said interpersonal learning, and the question said interpersonal relationships. You can use that technique to get the right answer, even if you don't know the answer, which can be a sad thing, but it's possible. Not sad for the person that gets the point, but I get it. All right. So we got to use those techniques. We got to learn how to. But our main focus is knowledge and empowerment, where you're no longer fearful for the task. You actually rejoice and look forward to the test day. Okay, we don't rely on test taking strategy. That is the back end, so we can get a few extra points. We got to really be keyed in the knowledge and understanding, because soon you will be a PMHNP board certified and you will be taking care of patients. Okay, so we got to make sure that you're ready for that when the time comes. Okay, we got 10 seconds left. Okay, if I trust that if you got it wrong, you were not in the class yesterday. We had an acronym I with 3 I's, soccer, and we went over the components of the Yalom group therapy, right? Altruism, universality, existential factors. We never talk about mindfulness meditation. We never talked about hypnotherapy or insight-oriented therapy, confrontation or directive leadership, right? So, but we are getting there. And if you are having an issue, please email me, pmhnp@npexamcoach.com, so we can dish it out what might be the problem, so we can get those somewhat easy points towards your board certification, okay? All right, few more questions to go and we'll be done for tonight. So everyone will get this 100%, yes?
Therapy.
Okay, so we said we need to put a white piece of paper and write down the family, structure, system, family therapy, right? And all, because too many S's, here, systemic, strategic, structural, right? We gotta be able to get 3 things for each. This question would have been super easy if we memorized those 3 things. When we think about systemic, we think self-differentiation, we think of triangles and triangulations, and genogram as well. Okay?
My hand picked it.
All right. So let's keep on moving. All right. I believe this might be the last question. No, got 2 more questions. Read it really well, okay, so you don't make a mistake here. Can be tricky, the answer. Okay, so this is a great example. Just like strategic, they use straightforward as a decoy to get you in the wrong way. Structural, which set boundaries. Do we want rigid boundaries? No, we do not. A rigid boundary is no is a no. I don't care if you're dying today, no is a no. No, there's exceptions, right? We want a boundaries. We want to know who's the daddy, who's the mom. who calls the shots. But there are times that even those that calls the shots, they can come and cry and do things differently, not super rigid. Rigid boundaries is always a negative connotation. So what the question did is use boundaries as a decoy to get you towards the wrong answer. What we want is boundaries, hierarchies, which here is a map tracking, to modify the family structure. Okay, so that's why I was trying to pull you back a little bit so you don't fall into this pitfall. But these pitfalls will be on the test, guarantee you. Not exactly the same, but they will pick bits and pieces of truth mixed with the incorrect sentence, makes the entire sentence incorrect. Just because you have boundaries doesn't mean it's straight structural therapy. So hopefully this was a good questions that we learned from it, not jumping to conclusion and really reading the answer to understand. Because the goal of structural family therapy is to change the family dynamic, right? Oh, it says power dynamics with the family are structured and allows for the potential reorganization. Same thing. All right, last question of the night. I will take a break after that and do few of the reviews. Oh, yes, catastrophizing, right? Well done. So, and the podium. Third place, Naya. Good job. CAPRN. And first place for the night, PMHNP. Awesome. I don't know who you guys are, but I'm very proud. Chidi and UTE PMHNP. Guys, there is no greater pleasure than learning. I mean, it is absolutely awesome. If you made a mistake, you actually learn more than those people that didn't, because now you had the chance to learn, right? So you had the chance to learn and see what we learn more on the mistakes than we ever will do on victories. On victories, we say, it was nothing. But we sure learn from mistakes. So never feel discouraged, feel empowered. Where you are, this is the progression that happens every single class. They go from the last one in Kahoot to the first place in Kahoot over time, right? I'll bet that none of these people, I don't know who they are because they didn't put their names. I know probably I know my students. I promise that I know them, but ask them if they score first place, second place, or third place right off the bat. No, this is a struggle. We start from here and they'll go up, 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 up to the moon over time. Okay, there is no easy answer. And anyone saying we have easy answers, probably not true. This is hard work. This is learning. This is repetition. This is doing it again. This is falling, getting up, and doing it again and again and again and again until you are successful. Okay? So what we'll do is that, let me see if I have this open, and then we'll take a break. So, but before we take a break, I just want to go back to the course. Once you go in the course, you can go all trainings. Module 4. Which was the module covered today. First training is Erikson stage. And here is your video.
Hello there and welcome.
Right? Right here is your PDF. So what we are going to do is go over this entire PDF, which is a 6 hours class in 10 minutes. So we're just gonna touch points on things that we may have missed or we need some awareness of the content. But before we do that, I'll stop my recording. For those that need to go home, has been a long 3 days. I hope you enjoyed the learning or the revising of the material. You will always learn more every time you revise. So if you've done module 1, 2, and 3, and before you start module 1, 2, and 3, module 4, go back to module 1, 2, and 3, just the same way we're going to do today. Fast, because you already learned, right? But we always got to go back, because every time we go back, we'll learn something new. I do that. I go back all the time. It is challenging, but this is where the real learning happens. So I'm going to stop the recording, and then we'll come back and we'll do a quick fire relearning or revisiting what we just covered in the last 2 days in the live class. So with that being